So which treatment do you give for severe patients, except, all the supportive treatment?
Just as you said, supportive therapy is the most important therapy for critical ill patients. And actually, we add some medicines such as IVIG, and for some patients, we use some heparin to do some coagulation therapy. And sometimes, if you find there are some infections, antibiotics are be used. But as you said that we don't hope that there is any powerful antivirus therapy that will be very helpful in the critical ill patients. Because just as Dr. Xiao said that for our patients who develop to the severe stage, the duration of the disease is about 20 days or for 2 months. And at that time, the virus didn't have much, the virus didn't cause so much symptoms, and we can find that the IgG and IgM is positive for these patients. So we think that we are dealing with the consequence caused by the COVID-19, but not the COVID-19 itself. So that's what we do in our critical ill patients.
I want to give some comment about your question. For the mild patient, besides the rest, in China, we should isolate the patient in the appointed hospital. All these kind of patients, these are mild patients, although they have no very serious symptoms, but the patient should be admitted to the hospital to prevent them from infectious to other people. For the moderate disease, for the moderate patient, of course we can give them some medication such as IVIG, just my colleague said before. But for this kind of patient, some of this kind of patient may progress into severe or critical patient. So prevent this moderate patient from going on to progression is very important. So at this moment, glucosteroid may be tested, may be prescribed in this kind of patient. In our hospital, in our intensive care unit, we use 40 milligram prednisolone to treat this 40 milligram twice a day to treat this kind of patient, and reduce the dose gradually. And sometimes interleukin-6 blocker or anti-interleukin-6 drug can be used, but the efficacy of these drugs need to be studied further. For the critically ill patient, of course, mechanical ventilation is a very important supportive treatment. But besides this, the invasive mechanical ventilation, many other treatments, we call the comprehensive supportive treatment. Comprehensive supportive, just as my colleague mentioned before, including the anticoagulation, because many of these patients have hyper and anticoagulation symptoms, including antiphospholipid syndrome and APS. So this kind of patient should be treated with heparin, sometimes plus aspirin, for the hypercoagulation. Also, the patient need the nutritional support. Maybe very, very important for the nutritional support. Also, the patient should pay attention to acid-base balance, electrolyte balance, etc., etc. In our hospital, in our ICU, we pay great attention to the comprehensive support for this kind of patients. Besides the respiratory support.